Hi, yes, this is Dr. Ron Miller from Pursuit Physiotherapy, and today we're going to go over what is a spondylolisthesis and can you treat this? Okay, so just for purpose of the video, when I use the word spondy, I'm going to relate it to a spondylolisthesis. Okay, so what is a spondy? So in the lumbar spine, sometimes you could have slippage of one vertebrae on another. It's supposed to be lined up like this, and then you have your vertebrae going up. What a spondylolisthesis or a spondy is when you get slippage where one vertebrae is sliding. It could be 25%, 50%, or even 75% on top of the other ones. And in the medical terminology, they call it a spondylolisthesis. But what should you do if you have a spondy? Now, a lot of times, if it's a severe case and you're playing a certain sport like gymnastics or wrestling, you may have to take some time off just to let things calm down a little bit. But there's no reason why you can't get back to running or back to sport if you address some of the root causes or affecting areas that is adding into the same pattern that the spondy is doing. So most of the times, if you have a spondy, you'll say that prolonged standing, laying on your stomach, bending backwards, all are going to increase your pain. And yes, it is more common in younger athletes who are gymnasts or wrestlers, and maybe even some swimmers too. But just because you have a spondy doesn't mean you have to have back pain. What you can do is look at the levels or the body parts above and below the spondy and try to treat them in a way that it takes the load off of that segment where you have the spondy. For example, you look at hip extension. Okay, if you're lacking hip extension, your hip flexor muscle, which attaches right to your low back area and to your hip, is going to pull on that spondy in the same direction of where it's causing your pain. So if you can increase hip extension through proper treatments, you may be able to deload that force or that load on that spondy segment, thus decreasing your back pain. So there are plenty of times where people come in with a diagnosis of a spondy. They've been correctly diagnosed with imaging, or even they have the onset of it, like a pars fracture, and they have pain with running, they have pain with their sport, pain with laying down and prolonged standing. And there's plenty of times that we can address these other impairments around that area and get them back into a running program, get them back into sport, and at least being symptom free throughout their daily activities. So if you've been diagnosed with a spondy and you're still struggling with pain, you're still having symptoms, give us a call. We'll get you in for a thorough evaluation. We'll solve these other risk factors and other impairments that are adding in to your problem, and we'll set you up for some goals and a timeline on when you can get back to sport, back to running, and back to being pain-free. So if you have any questions for us, you can give us a call at 407-494-8835, or for more information, you can visit our website at pursuittherapy.com. And thank you for your time.